My name is Professor Dr. Somashekhar. I'm a robotic surgeon and a surgical oncologist and chairman of Manipal Comprehensive Cancer Centre and the Intuitive Manipal Robotic Institution at Bangalore. These are the times which are tough time which world faced. You know that India got affected somewhere around March with this pandemic, which is very rampant worldwide. But this is something which we should not sit and mourn. But what is most important is to understand we need to learn to live with this, make modifications, and understand the new normal. Now, if you look back, what has happened right from February, March, most of the countries, including India, went on lockdown. Now, remember, the mortality of COVID is 0.5% only, but the mortality of untreated other disorders like colon, rectum, cancers, and other diseases is 30%. So, we should never ignore the curable, potentially treatable conditions, which if ignored will lead to 30% mortality. So what happened is during this pandemic time, we didn't want to do a major open surgeries, patient stays in hospital for a week together, surgeon, assistant, sisters all scrubbed together, lot of instrument to be used, lot of vaporization happening, complications, pain, ICU stay, and then causing risk to patient, their attendant, doctor, healthcare worker. So the new normal that all of us have adapted and we realized is minimal access surgery, especially robotic surgery. Because in robotic surgery, we use 2 or 3 instruments only. And surgeon sits in the console and one bedside assistant with sister. Minimum interaction and maximum benefit with minimal invasive nature. So patients go home same day or next day, no need for ICU, less complication, less readmission, less infection, quality of surgery is also very good. So this pandemic is like a boon for patients who are actually candidate for robotic surgery. So the new normal is minimal access surgery with keyhole robotic surgery, which is the best time. Patient comes quickly, goes home quickly, less to no complication, no blood transfusions, no ICU stay, and low complications. So worldwide now, there is a rapid push to robotic surgery during this pandemic because this is the ideal situation in this condition where patients can go home early with less complication and less exposure to patient, attendant, healthcare worker, hospital, yet not compromising the outcome and clinical condition for the patient. See, now what is important is in this pandemic, the interaction, you know that what are the 3 important things for COVID we say? Physical social distancing, which means the more close you are, more interacting every day, chance is more from them to us, them to them. Then hand washing and mask. Now what is ideal? In an open surgery, you are into the tummy of the patient. You, another surgeon, one assistant, sister, then you do a major surgery playing with the body fluids, contact. Because of the cut, patient take long time to recover. Every day they will stay in ICU, ward, OPD, ambulation, infection rate, then again more dressing. Now look at minimal access. Once you dock the robot, everything is sealed. You don't have direct contact. Very minimal people. Natural physical distancing is maintained. Because everything is keyhole, patient can eat same day, walk same day, pass urine and motion same day, go home next day. So no wound complications, no infection. So ideal for us, which is explained by WHO, the physical distancing, less interaction is actually de novo inbuilt in the robotic technology. That's why robotic is ideal thing during pandemics. This is something very important. Minimal invasive, less human interaction. Surgeon sits somewhere on the other console, not touching the patient and finishing the surgery. All the keyhole robotic ports are docked. And then after the surgery, patient walks around and we discharge the next day. So it fulfills all the criteria of natural physical distancing. Now what happened is initially SAGES brought a guideline. We don't know what is the efficacy and safety of minimal access. Immediately the International Society of Robotic Surgery, the SAGES, the International Society of Gynae Onco, International Society of colorectal, and Indian Society of Surgical Onco, and we have an academy in India called as AMASO, Academy of Minimal Access Surgical Onco. I wrote a white paper draft for safety, adaptation, and then precautions that needs to be taken to do safe robotic surgery during pandemic. All these guidelines brought a protocol. What are the protocol? The protocol number 1 would be patient needs to be screened for RT-PCR, HRCT, so patient is safe. And then the surgical OT modification is called as rule number 20. 20 air cycle per hour, and then 20 minutes difference between 2 cases. intubation, extubation, 20 minutes to wait before we enter the OT. Temperature at 20. Then all the pneumo and the smoke that comes through the robotic ports is went out through a specific smoke evacuator, passed through sodium hypochlorite. So these are the 3 modifications which we did and followed the robotic safely, and we have done over hundreds of them, and not one patient became positive, none of the risk to the patient or any risk to the healthcare worker. Successfully we are sending. Now the more number of surgery I do is the robotic surgery day to day to benefit the patient. So these are the modification at 3 level we did it. Normally in any surgery during pandemic, we need to wear something called as PPE, personal protection equipment. So you wear actually N95 mask, the visor, the P100 respirators, whole body. But beauty of that in robotics, we don't have to fully immerse ourselves. So surgeons invariably wear a good personal protection equipment during surgery. One beautiful thing is, since we are not sitting on the patient or touching immediately, we are sitting in the surgeon console. So we do specific OT modification. The surgeon console on the robot, we clean nicely with sodium hypochlorite, we sterilize the whole thing, and then so the surgeon always wear N95 mask, and whenever you change the 2 surgeon, we clean the equipment again. So these are the personal protection. For robotic, it is little less than normal open surgery. That's why, because there is a less interface between the patient and the surgeon, and we sit in the console. That's why it is more comfortable. Okay, first of all, robotic surgery is painless, minimal invasive, fast recovery, fast chance of passing first flatus and then bowel movements, able to eat on the same day, early mobilization, less complication, and early discharge. Yet not compromising the outcome. In fact, the micro dissection we do inside the abdomen, chest is far superior. So combined to all this, patient can go home like a daycare or maximum next day morning. ERAS protocol can easily be uploaded. No tubes are required. There are no cuts. Complication is very minimal. Both beneficial to patient, to the surgical team, healthcare worker, and also healthcare system. For about 2 to 3 weeks, elective surgeries were stopped as per the Government of India guideline. But then all cancer and emergency surgery were done. Ever since last week of April, we have not stopped any surgery. Every week we perform robotic surgery, and all over India, all the robotic surgeons, monthly hundreds of them are being done. In fact, now that has taken the more volume. So there are hundreds of robotic surgery done every month. Not only my institution of robotic, all over India safely. In fact, now it is more easy because quick surgeries, we can do 2 to 3 surgery on the same day, and patients can go home very, very easily, comfortably, less complication. So now the new normal is minimal access with robotic during this pandemic time, and nobody has stopped performing robotic surgery. In fact, they've embraced more and increased their number now. Now, such things are governed by the guideline and the rule of the law. Every country has a different guideline. In India, it is governed by the Ministry of Health and ICMR. So ICMR brought a guideline in March that cancer surgery, immunocompromised patients, and SARI only should be done. But soon, by about April, May, the guideline changed that if the treatment outcome changes, you can do. In our hospital, all the patients undergoing surgery has a RT-PCR swab testing done, so we can triage the patient who are at risk, who are not at risk. We have different OT for positive and negative with protection. So in our hospital, as of today now, all patients undergoing surgery are undergoing RT-PCR swab test. So we know very well the outcome in a positive patient post-op, lung management, anesthesia is different. So we triage them. Yeah, during the robotics, we performed gynec cancers, endometrial, uterine cancer, cervical cancer, sentinel lymph node, colorectal surgery, sphincter preserving LAR. I've done a robotic lungs and robotic esophagectomy, food pipe cancer, and robotic colon surgeries, robotic thyroidectomy, and then also robotic gastrectomy. And my colleague urologists are doing robotic prostate surgery, kidney surgery. So practically we are not stopped. All over the body, all the surgeries are done as before, in fact more safely now.